Today's patient is a 65-year-old with Parkinson's disease. She appears to have impairments that are affecting stride length and gait speed as she ambulates. These are going to be the main areas addressed in today's treatment. The patient has also had decreased vision and sensation secondary to diabetes, so these will also be taken into account by using brighter colored objects and different surfaces to help those deficits. According to Lin et al., practice schedules for Parkinson's patients have been shown to be more effective on motor learning when block practice is used, so the treatment today will focus on just one aspect at a time without random or variable practice included.
Alright, so today we're going to work on your stride length. You've been taking some short chop steps. So what I'm going to have you do is alternate every other foot, stepping over these colorful bands, like so. I want you to think about taking long, nice, even steps. So whenever you're ready, go ahead.
Will be completed based on.
Yep. As long as you can. Keep going. Keep going. Just don't forget. Here, you're going to turn around. I just have to have this turn into Dawn and this shape for my other side towards me. Now you're going to go back 5 times. You go taking nice, long, even steps. Good. Turn in a big circle. Good. Now this time, make sure you're moving your arms. Big circle, turn to your left. Big steps. Try to speed it up a little bit. Good job. Big circle.
The patient is practicing ambulating with visual cues on the floor in order to help increase her stride length and create a more even gait pattern. Sidaway et al. Found this gait training technique to be effective even 1 month after training with these visual cues was completed. Sidaway also found that 1 month of gait training with visual cues was successful in establishing a lasting improvement in gait speed and step length while increasing the stability of the underlying motor control system. In their study, visual cues were 110% of the patient's original stride length and then increased to 120% later, which is how we would also progress this patient in future treatment sessions. Treadmill training has been shown to be effective in helping Parkinson's patients maintain their fitness levels and slow the progression of physical complications. Recently, Schulman et al. Found that treadmill training at a higher intensity than normal was beneficial in improving gait patterns in Parkinson's patients. They compared treadmill use by allowing the patient to choose a comfortable pace for themselves, and then compared that to another patient who would have the speed increased above their comfortable pace. Results showed that more improvements occurred when the speed was increased past their normal slow shuffling gait speed. They demonstrated a longer stride and faster step rate, which are two of the goals for our patient today. This patient began by starting the treadmill at a comfortable pace and got going, and then we increased the speed a couple tenths of a mile per hour above that. And as you can see, as she keeps walking, her stride length becomes more even and she is able to keep up with the faster rate. This is something that she can progress at home and would not have to be done on a treadmill, but she could do it by keeping time on a watch. Due to this patient's decreased sensation in her feet from her diabetes, we are having her ambulate over a foam mat, walking forwards and backwards to make this similar to a situation she may have when she's walking through her yard or walking through a store, on thick carpet. Here she is forced to use more vestibular and visual inputs to help compensate for the decreased sensation while she is on this compliant surface. As we see, she does fairly well going forwards and backwards. However, she does have a decreased arm swing, which we will try to focus on later.
For this one, we're going to have you weave in and out between the cones like this, turning at each one, going between them, and at the end you'll turn around and come back through, one between each one. And we just want you to make sure that you're turning equally between the cones. And we don't want you to kick them, so make sure you're kicking up your feet each step. Yep, whenever you're ready. Good job. Take a big turn. Come back. That feel good? Alright, we're gonna do this 4 more times. Keep it up. You are doing great. We're also working on your vestibular system at the same time. And your eyesight is very close. Good job. 3 more times. Alright, 2 more. Good job.
Now we will practice walking around an obstacle course with verbal cueing to swing the right arm to help maintain symmetry and increase stability during gait. Parkinson's patients often have a hard time ambulating through doorways or around objects, so our patient is practicing avoiding the cones while performing a continuous movement. We hope to see the patient be able to weave in and out between the cones after doing this a few times without kicking them over and without stalling at any point.
Go.
Alright, what we're going to do is work on your sit to stand. So for this, I'm going to tell you to move upward and you're going to lean forward and go ahead and stand up. And when you do that, I want you to follow this with your eyes. I'm going to move this up as you stand up. Okay? So we're going to do this 10 times. So whenever you're ready, go ahead. Move upward.
Or you can even have some like pick themselves up too.
According to Bott et al., compared with people who were healthy individuals, people with Parkinson's disease had greater backward instability resulting from a more anterior center of mass position when they begin takeoff from a seated position. Combined with their decreased forward stability at movement termination, they had an increased risk of forward balance loss at the end of their movement. After training, people with Parkinson's disease achieved greater backward stability through an increased forward center of mass velocity at takeoff from the seat and reduced the likelihood of a forward balance loss at movement termination through a posterior shift in the center of mass position. This treatment was used in a study where they cued the individual verbally by saying move upward while simultaneously holding a brightly colored object in front of them to follow visually as they stood up. Before treatment and sit to stand, the patient had a hesitation between the momentum and extension phases of sit to stand. During and following this treatment, we want to see the patient have a more fluid transition from the sit to stand position, and this can come from increased strength in the hips as well as timing and coordination due to verbal and visual cues.
Okay, so for this one, we're going to work on your hip strength. So what we're going to have you do is you're going to stand on your left foot, bring your right foot up, and you're going to kick each cone off. Between each one, you're going to bring your foot down, move over, and kick the next one off. So if you want to start on one end, go ahead. Think about lifting up high, Get over. Nice. Over the next one. Good. Good job. Last one now. Nice job. Like this one here. Go ahead. Cool. With my right foot again. Yep.
According to Inkster et al., one of the main problems for the sit-to-stand movement in Parkinson's patients is a decrease in hip strength rather than a decrease in quadricep strength. So we're focusing on increasing strength in the lateral hip rotators as we perform single leg exercises. As the patient progresses with these exercises, we hope to see her be able to hold a single leg stance position for a longer amount of time, and this will transition to an increased fluidity in her sit-to-stand transition.
Alright, we're going to work on your hip strength here. So we're going to do some lateral step downs. For this, you're going to slowly lower yourself down, keeping your hips straight. Slowly come down, touch, and come back up. Good. We're going to do this 10 times. Nice job. Good. Got it.
Yep.
Okay, let me help you this time. Good job. More. I mean, I'll work on it later. Okay. Nice. It was just hard because Alright, we will do that same thing on the other side. Step over here. Come up and slowly lower yourself down, tap your toes, come back up. Nice. So just going to work your hips a little bit more so they come into the standing or seated position. Good job. Way to catch yourself. I'm encouraging my patients. 10. Doing great. Alright, good job.
This poses to be a challenging exercise for this patient due to her decreased sensation in her feet as well as weakness in her hips. However, we chose this exercise because it strengthens not only her hip abductors but also works on the quadricep strength. Both of these things are key in improving her sit-to-stand strength as well as working on her balance, which is also an area that can be targeted in Parkinson's disease.